Most seniors believe that more medical testing means more protection, but the truth is far more complicated. Some of the most common tests ordered for adults over 70 can actually create unnecessary fear, trigger invasive procedures, or lead to complications that never needed to happen in the first place. Today, we're exposing 5 medical tests seniors should think twice about, even if they seem routine or harmless. These tests are widely used, heavily promoted, and often automatic. But once you understand what they can set in motion, you may never look at them the same way again. Before we start, let us know in the comments, where are you watching from and what's your age? And have you ever undergone a test or procedure that you later regretted? Share your experience. We reply to every comment with personalized guidance. If you find this helpful, please like this video, subscribe to the channel, and share it with a friend or family member who might need this information. Let's begin. Checkup number 5. Thyroid ultrasound for mild common symptoms. Fatigue, weight fluctuations, and feeling cold are extremely common experiences in older adults. Yet these symptoms often trigger a thyroid ultrasound long before one is truly needed. The problem is that by age 70, thyroid nodules become extremely common, and the vast majority of them are completely harmless. An ultrasound isn't magic. It simply reports every bump and every small tissue change, even if it's totally normal for your age. And once those findings appear on a report, the medical system tends to react aggressively. Repeat blood tests, follow-up scans, biopsies, and even surgeries. Take Janet, age 74. She went to her doctor because she felt unusually tired for a couple of weeks. A basic blood test showed a mild imbalance, so an ultrasound was ordered. 3 tiny nodules showed up, none of them larger than a pea. Even though her doctor reassured her it was probably nothing, she was sent for biopsies just to be safe. The biopsies were painful and inconclusive, which led to the next step: surgery. Half her thyroid was removed, her voice changed, and she now takes medication for life, all for nodules that turned out to be completely benign. This is why seniors should pause before agreeing to an ultrasound for mild symptoms. A simple blood test may be all that's needed. Before scheduling imaging, ask your doctor, what will we do if this ultrasound finds nodules? Will this actually change anything for me? Is this test necessary based on my symptoms? If you've ever felt pressured into a medical test, tell us in the comments. Your story might help someone else avoid unnecessary risk. Checkup number 4. Mammograms. After age 75, mammograms save lives earlier in adulthood, but the benefits shift dramatically after age 75. Breast tissue naturally changes with age, and benign findings become more common. The problem? These normal changes often look suspicious on imaging, leading to a series of stressful and invasive procedures. Women 75 and older are far more likely to experience false positives, unnecessary biopsies, and surgeries than to find dangerous cancer. And many of the abnormalities discovered at this age grow so slowly that they would never cause harm within a normal lifespan. Consider Linda, age 78. She had been getting annual mammograms since her 40s and never questioned whether she still needed them. One year, a shadow appeared on her scan. She went through additional imaging, then a biopsy, and finally a partial surgery. The final pathology showed nothing dangerous, just benign age-related tissue. She lost weeks recovering and months dealing with fear, all for something that didn't need intervention. If you're over 75, make breast cancer screening a personalized decision, not an automatic routine. Talk openly with your doctor and ask, what are the chances a mammogram at my age will truly help me? And what risks come with additional testing? If this information is useful to you, hit the like button. It helps our channel reach more seniors who deserve clarity. Checkup number 3. Full body skin exams without symptoms. Your skin changes naturally as you age. Sunspots, rough patches, lighter or darker areas, small growths, most of these are harmless. But many dermatology clinics recommend routine full-body exams, even when a senior has no symptoms and no history of concerning lesions. These routine exams often lead to unnecessary biopsies, especially in older adults whose skin tends to develop harmless but visually unusual spots. And once a dermatologist decides something looks atypical, the next steps often involve multiple removals, stitches, scarring, and follow-up procedures. Meet Victor, age 83. He felt perfectly fine, had no new moles, and no lesions that caused concern. But during a routine checkup, he was talked into a full-body skin screening. In that single appointment, 9 spots were removed. 7 were benign, 2 were labeled uncertain, leading to additional removals. Victor now has scars across his arms, back, and chest, and every one of the findings was harmless. Skin exams are absolutely important when you have a changing mole, a lesion that bleeds, a spot that grows rapidly, a patch that becomes painful. But routine full-body screenings in seniors without symptoms often create more harm than benefit. Leave a comment below. Do you think seniors are getting over-tested? We'd love to hear your thoughts. Checkup number 2, echocardiograms for mild breathlessness. Many seniors experience mild breathlessness, and most of the time the cause is simple: dehydration, medication side effects, lack of sleep, stress, anemia, or reduced physical conditioning. But because heart disease is a major concern, doctors often order an echocardiogram at the very first mention of shortness of breath. Here's the issue. Echocardiograms almost always find abnormalities in older adults. Mild valve leakage, slight stiffness, small regurgitation. These are extremely common and often harmless. But once listed on a medical report, even harmless findings can result in a spiral of unnecessary testing, stress tests, angiograms, medications, and consultations with multiple specialists. Take Harvey, age 77. He felt slightly winded carrying groceries up the stairs. One test led to another, and suddenly he was facing discussions about potential valve repair, even though he had no major symptoms. A senior cardiologist later confirmed that his echo findings were entirely normal for someone his age, and that he didn't need any treatment at all. If you experience severe chest pain, fainting, or breathlessness that worsens rapidly, heart testing is essential. But for mild occasional shortness of breath, an echocardiogram may not be the best first step. If you appreciate this level of honest health content, subscribe now. It helps us build a community of informed seniors. Checkup number 1, full-body CT scans for peace of mind. This is the most dangerous test on the list. Full-body CT scans are marketed aggressively to seniors as a way to catch everything early. But these scans expose you to large amounts of radiation and frequently reveal harmless abnormalities that lead to invasive and stressful follow-up procedures. CT scans pick up small lung nodules, tiny cysts, mild calcifications, old scars, and age-related changes that almost every person over 70 has. But once these findings show up, they often trigger a chain reaction: more scans, biopsies, and even surgeries. Meet Roland, age 81. He felt healthy and bought a full-body CT scan because a clinic promised it would give him peace of mind. The scan found a minor lung spot. He went through a PET scan, then a biopsy. During the biopsy, his lung collapsed, a known complication. He was hospitalized for 9 days. The spot turned out to be harmless. He went in perfectly healthy and came out injured, not because he was sick, but because the test led him down the wrong path. Full-body CT scans should never be used for routine screening in seniors. They create more risk than benefit. Today's takeaway: these 5 tests can transform healthy seniors into anxious, over-tested patients. They may expose you to radiation, biopsies, surgeries, or psychological stress that offer little benefit at an older age. Before agreeing to any test, always ask, what happens if this test finds something? Will the results improve my health or simply increase my worry? Is this test truly necessary for someone my age? Real prevention doesn't come from excessive testing. It comes from lifestyle choices: daily movement, healthy eating, quality sleep, hydration, social connection, and managing real medical needs without fear. Thank you for watching. Please like, comment, subscribe, and share this with someone who wants honest, reliable health guidance. Stay informed, stay empowered, stay well.